Hi, I'm Dr. Rebecca Dale from Arbor Eye Care. I've been helping patients with cataract and refractive lens exchange surgeries for nearly 2 decades. This is the third video in this series. It may help you to begin with the first videos, What is cataract surgery? And Which intraocular lens should I choose? Part 1, which is an optics crash course. Please know that I'm offering this information for general education, but this is no substitute for an in-person evaluation. The decision of which lens is right for you should be made together with your surgeon. A lot of people will ask me which lens is the best, but unfortunately it's not that simple. First of all, regardless of which lens you choose, please be assured the quality of all of the different intraocular lenses are excellent. There isn't a cut and dry best for every patient. At your preoperative consultation, we want to get to know both your visual goals as well as your eyes. Take some time to think about how you feel about glasses. Would you be happy to wear glasses after cataract surgery, or would you like to decrease your dependence on glasses? It's important to know that no lens offers 100% independence from glasses, but there are lots of choices that can decrease how frequently you need help from glasses or tools like contact lenses. Also spend time thinking about how you use your eyes. Do you want to be able to swim or hike or ski without glasses? Do you need to see multiple distances? For example, being able to both drive and see your dashboard. Do you have special work requirements? Are you a pilot? Do you work in a dimly lit environment? Do you do any special activities like target shooting or tying fishing flies? Do you do fine needlework? Are you an artist? All of these things are important for us to help customize the choice to best fit your goals. There is no one right answer for this because it depends on what your goals are. At your preoperative consultation, we'll look at the shape and health of your eyes. Things like dry eye, problems in the retina, or double vision issues can all impact which lens is a good choice for you. I like to group the intraocular lenses into 4 different categories. Let's break it down. Category 1 is what we would call a single focus lens. This is the lens that's generally fully covered by most insurance plans. A single focus lens does not contain correction for astigmatism. A person with no astigmatism may end up with focused vision with a single focus lens, but a person who has astigmatism would still need glasses to sharpen their focus. The second category of lens is also a single focus lens, but this one incorporates astigmatism correction. If your cornea is more football shaped rather than basketball shaped, then you can use glasses or contact lenses to correct for that astigmatism. We can do the same thing with the intraocular lens that we implant. There are differences in the measurement of astigmatism and how different patients heal and how the lens settles. So this lens is intended to reduce astigmatism, but it may not eliminate it 100%. So if a category 1 or a category 2 lens, a single focus lens, either without or with astigmatism correction, is right for you, where do you want your focus to be? Would you like us to set your focal point for distance, for intermediate, or for near? The next category is a big one, presbyopia-correcting lenses. Presbyopia is the normal aging process that all people experience where the lens stiffens with age and we can no longer shift our focus from distance to close. It's the reason many people begin wearing progressive glasses, bifocals, or over-the-counter readers when they hit their mid-40s to early 50s. There are 3 main options in this category of presbyopia-correcting lenses. The first option is what's called an extended depth of focus lens. It works by creating a single elongated focal point to enhance the range of clear vision. It's not splitting the light into multiple focal points, it's stretching it out. There are limits to this technology. Generally, it's considered to provide good distance vision and good intermediate vision, but patients will likely need some extra help from glasses for things that are closer up. Another way of compensating for presbyopia is with a multifocal lens. Multifocal lenses have different zones for distance, intermediate, and near vision. They split the light into multiple focal points. This design helps people to do most activities without glasses. People with certain eye conditions like uncontrolled dry eye or retinal problems may not be good candidates for multifocal lenses. A newer strategy for correcting presbyopia is a small aperture lens. The small aperture lens works similarly to a pinhole camera. By limiting how much light is coming into the eye, it decreases aberrations, and this can be especially helpful for people who have significant irregularities in their cornea. They decrease the amount of light that's reaching the retina and may affect vision in low light conditions. The last category 4 is the light adjustable lens. Light adjustable lens is different from all of the other designs because it can still be adjusted after your surgery. In most cases, about 4 weeks after surgery, after your eye is healed, you can begin light treatments. A special UV light is used to adjust the lens and actually change its shape. I liken the process with the light adjustable lens to playing golf. With the surgery, you're taking your first big drive. If you have a cataract, we're taking care of the cloudiness from the cataract, and additionally, the lens is going to help decrease nearsightedness or farsightedness. We then let you heal for about 4 weeks after the surgery. Many patients will still have some astigmatism, nearsightedness, or farsightedness. Now we get to putt. We get to do light treatments using a special UV light to change the shape of the lens that's already been implanted in your eye to match your new focus. We get 3 light adjustments to fine-tune your focus. Then we lock it in with 2 final treatments. Once we've started the lock-in process, we can't change the shape of the lens anymore. One of the interesting things about this technology is it allows us to customize things after the fact. For example, if you're interested in monovision but not sure if you'll like it, then we can test drive that with a contact lens while you're going through your light treatments. You get to experience what that focus is like before we use a treatment to change the shape of the lens. We should also talk about glare, halos, and starbursts. Unfortunately, all lens types can cause these visual aberrations. Most commonly, this is seen when driving at night. Some people will need an adaptation period to get used to the new visual experience. Sometimes this process, called neuroadaptation, may take months. Multifocal lenses tend to have the highest percentage of patients who experience glare, halos, or starbursts. Extended depth of focus lenses have a lower level, and the lowest level of glare, halos, and starbursts comes from monofocal or single focus lenses correcting astigmatism and the light adjustable lens. I also want to explain what monovision is. Monovision is a strategy where usually the dominant eye is focused for distance and the non-dominant eye is focused for close-up. There have been high success rates for patients adapting to this. One study showed that more than 90% of patients were satisfied with monovision after cataract surgery. But there are some things you need to understand. Monovision does cause a decrease in depth perception. The bigger the focus difference between the 2 eyes, the bigger the loss of depth perception. Some people also have some difficulty fusing the 2 images or ignoring the blurry image. Some patients have already experienced this with contact lenses and are well adapted. For patients who have never experienced this before, I tend to recommend what's called mini monovision, which is doing just a small difference between the 2 eyes rather than a large one. If you choose monovision or mini monovision, you can still wear glasses or contact lenses to balance the eyes out. For example, some patients may like monovision when they're around the house, but want to put on glasses to balance the 2 eyes out when they're driving. Whichever lens you choose, we want you to have a safe and comfortable experience. Our goal is for you to have clear, comfortable vision and healthy eyes.